So, hello everyone. I'm Gabriel Altit, one of the neonatologists at the Montreal Children's Hospital. And today we really have I have the pleasure and really it's super nice and generous from the part of the family of Massimo to join us. What we're going to do today is just go through a bit of the course of Massimo's beginnings and where he is now, such a wonderful little boy full of energy, extremely adorable. And I think, as parents, you're going to give great perspective to maybe future parents on the course of what it is to live through the NICU, at least one perspective from a family. And we'll be talking a bit about, what happened to Massimo throughout the course of NICU and then after the NICU. And then you as parents, what did you live during these moments that were, I know, roller coasters? So I really wish to hopefully give some hope and also to give some perspective to other future families, because I really think that you have a beautiful story and I really want to have it out there for the parents of our, NICU. So maybe first of all, you can present yourself, talk about Massimo, and then we'll go on from that.
Well, I'm Massimo's mom, and this is the dad. I guess the story of Massimo is, long story short, he was really an unexpected baby. We went to Lakeshore. It was minor bleeding, and they're like, well, no, everything seems to be fine. We'll just go back home. If anything, if it happens again, come back. And then we did, because it did happen again. Then we came back. And then they ended up realizing that I had a very short cervix and I was supposed to go on bed rest. That was the end of the story. All's good, but we're going to keep you overnight for observation because that's just the protocol. And then the contractions happened at night. I did not even know it was contractions. I don't think the nurses knew it was contractions either, until it was a little too late. And they're like, oh, well, Massimo's coming now. So ready or not, you got to deliver. And that's where the whole NICU team came. And I'll let Anthony continue since he loves that part of the story.
Yeah, no, definitely that sums it up nicely. I kind of like Priya. My name is Antony and my wife's name is Priya. Kind of like she said, we kind of hit the ground running, not expected, and it's kind of the approach you have to take with the whole NICU stay. There really isn't time to look back. As a parent, the more involved you are, the better it is for the kid. And it starts really from the beginning. We were really fortunate that the transport team from the children's arrived very quickly, had time to set up, give us a sense of what's going to happen. Then when Massimo was born, they reacted, and it really looked like just superheroes showed up.
And not only that, it just because I guess as a parent, your first question in mind is he going to be okay? Because I mean, you don't have to be a doctor or in a medical profession to know 24 weeks. Giving birth at 24 weeks, it is really early, right? So I guess we kept on asking the Lakeshore team, we're like, well, is he going to be okay? And their faces were blank. So no words of reassurance, no words of anything. It was just like, well, we don't know. We'll see. Yes, like literally that was it, right? Yeah. A shrug of the shoulder, and you're like, okay. But when the transport team came, so even I'm sure they probably did not know what the outcome was going to be, because I'm presuming it's 50-50. But that's just the way they presented it, right? They're like, we've got this. All you have to do is push. We've seen a lot of these cases. Don't worry. Just, so it was a little words of encouragement. And that's nice to hear, because you're like, well, not all's lost. Okay, there's hope. All right. So it was really, like he said, it was like a bunch of superheroes that came in and they're like, we've got this. You just gotta give us the baby. Yeah. And then we'll take it from there.
Yeah, we even remember, the nurse was Nicole, was very nice, and the RT his name was Jason, and they were both cracking jokes. So here we are, which is not intuitive in a moment like that. It's something very, I didn't even know babies could be born at 24 weeks. You're very stressed, you're not sure how it's going to come out. But then here you have individuals show up very confident, really clearly know what they're doing, and they're also trying to make you laugh a bit. And it's not, it was not what you expect, but it helped. It helped us settle the mood. It's helped us calm down a bit. It helped us kind of also follow instructions from them. Like once they stabilized Massimo, they put him in an incubator that was with the paramedics. Okay, this is what you're gonna do. He even told me, we need time at the children's hospital. You go home, you shower, you pack a bag, you come. He's gonna be ready. And so I think just that professionalism and that really helped a lot.
And I know Anthony's saying cracking jokes, and maybe to a normal parent would be like, well, that's really insensitive. No, that's the kind of parents we are. We wanted the mood to be lightened because we wanted Massimo to be born in an environment where he heard laughter and not, like the positive environment. And I can't state it more. Like the positive environment probably does have an impact, right? So like when a baby is born into this positivity, laughter, joyful place, then it just makes them want to live, like to fight for it. So that's why. So it's not they just come in and start cracking jokes, but it was just the environment, this mood that we wanted to set for a little baby.
Yeah, and you are like, now we've met for months, and we know you guys, like, you're a joyful family. You're a family that's, very tight together. We spoke a lot about spinning and all these things. Like you're clearly a family that values a lot like familial activity and laughing and joy of life. So that makes like such a huge difference when you take this outlook, even in these very challenging times, often it's, I think as medical professional, what's one of the big challenges to remind parents, like, don't forget your mom, your dad, your role is so important at the bedside. You are like part of the team, but your mom and dad, and you need to find joy in all of these little moments, even the hard ones, because they're so precious, right? Like you're gonna carry these moments with all the kind of heaviness they may have, or more like the joy they have, but you still need to find the joy in them, because these are very precious moments you're spending with, your child and your family. And definitely, I think, what was for me as an outsider, I could see how much you were parents, like so dedicated in every moment of the care and the growth and the development of Massimo. And I think definitely it makes like such a huge difference, right? It's like the best therapy you can give to any baby, right?
Thank you.
Yeah, really, definitely.
Yeah, and you're 100% right about being part of the team. And it was Dr. Dubey who was the first physician that I met when I went, and she gave me that speech. She said, that's it. Now you're part of the team. That's the best way Massimo's going to have the best outcome. And okay, great, thank you, no problem. We're going to do whatever we have to do. We started seeing a lot of examples of that. And the first example I saw was recording story time. So we would read to him a lot. And then when Dr. Dubey said somebody's going to come by and give you a record next time you read him a few stories. And overnight, we would start getting comments not long after birth from nurses that he reacts to your voice. So that was heartwarming.
To me, he's like, you passed the hearing test.
Yeah. Well, yeah, the brain scan was nice that he passed. Yes.
Yeah, the hearing test.
But this was nice. It was a little heartwarming. Yeah, you're right.
It's so important. We have like, and I'm sure you've lived it, we try to encourage a lot families to do a lot of like reading and talking and singing, because there's so much about voice imprinting and language acquisition, and their brain is like such a sponge of like sensorial learning. And, I think it's so important that you create, first of all, the bond, but create this stimulation. And I think you said it so well: recording, bringing books, reading, talking, being present, and a lot of like the skin to skin and the touching, even if sometimes I know it's harder to actually bring on you, but you being on, very present.
Oh, I think you froze for a second.
Oh, sorry, I'm back.
You froze for a second. You were at the skin to skin, and then you froze. Sorry.
Yeah, which was exactly the message I wanted to pass. Like the skin to skin, even in any ways, fashion is so important. That, for our babies in the NICU, I think, one thing I'm hopeful that future parents are aware is that we're going to include them in that, and we're going to support them in that, even if sometimes it looks scary. So I don't know, maybe you can talk about your first time you had skin to skin, both of you.
Sure. Well, first time was Anthony. I was terrified. He was tiny. So I'll let him tell the story.
No, it was exactly like you said. It was very scary. He's a pound and a half, 700 grams. But then again, like, I just kept remembering, and Dr. Dewey said, you're part of the team. We need, we need you to participate. Okay, great. So is skin to skin what he needs? Yes. Okay, great. So you kind of, everything else kind of goes in the back of your head, and you move forward, and you just follow the instructions of everybody who's there, and everybody was great. And then once we day one, I had the skin to skin. Actually, it was January 1st. It was third day of life. They allowed us to hold him for the first time after they saw he was stable. And then after that, after I did it and initiated, my wife took it from there and never gave it back.
It is very true. I got very jealous very quickly. But reverting back to your comments about how it can be scary and how it's important, our child self-extubated himself, right? So
yeah.
I think it was like within the first 2-3 weeks. Yeah. So here I am finally getting the hang of it, holding him, getting excited about it. And then suddenly it's time to put him back. And I guess because they're so tiny that the tube that's inside them is just dislodged, and then he self-extubated himself. Never expected that to happen. Nobody tells you about this because nobody hopes that it's going to happen. So that was a scary moment. I did not hold him for the next few days. It took a lot of convincing, but it kind of like goes back. So it can be scary, but everybody kept on saying how important it is, and then the benefits outweighs the risk, and to go for it. And I can understand as a parent, it can be traumatizing. You imagine, so many different cases. One of them actually happened to us, but still, even though it stopped us for a few days, but then we kind of picked up on it. So it's kind of getting over the hump again. And once you get over the hump again, then you're like, okay, I'm okay. I can do this again and again. So yeah, we were paranoid for a few days, but then we kept on going. And it just because, again, the benefits outweighs the risk. So we kind of went with it, and we're like, all right, this is what our son needs, regardless of what he does. Please do not self-extubate again.
It's so important what you outline is I think you showed like a bit of that, the roller coaster of emotions, and trying to, like, on one part being logical, and on one part being like, well, I'm a mom, I'm a dad, I cannot be logical right now, like I'm like so emotional, and whatever the doctor, the nurse, the respiratory therapist are telling me, like, oh my God, he has self-extubated, how am I going to get back into that situation? And we try to encourage and push, but for sure, there is definitely a roller coaster feeling to like live NICU, to be in that, environment. It's like so much emotions, and it's so much, rapid changes all the time. And I'm hopeful we're able to support the families and support you guys as a family when you went through all of that. But I think one thing I want to go back and address is many families I met, especially, that are in that situation of preterm labor, the first thing I try to tell them, and I hope we told you guys, is that, there's a lot of guilt for some reason talking about prematurity. What placed me in that position? What did I do or did not do? And like me personally, each time I try to meet a family, I tell them, like, I hope someone told you, like, there's nothing you could have done. It's like, we see that every day. This is our job. This is why we're here. And all of these things that occur are coming like on us by nature. Like, this is a random event that occurred. And same thing, the self-extubation is also random. It's not because you took on kangaroo, or it's not because you moved the baby. It happened, right? And it could have happened in the bed too, right? Yeah. It could have happened in the bed too. So I hope someone...
Yes.
No, Massimo, yeah.
But it's true that he was like a very energetic little boy, right from the get-go. And it's crazy, like we see so many of these babies like Massimo, and they all have their like personality, like right from like day one, it's like they have their own character from the first hour of life.
He was very feisty, and I always remember the story of one nurse. She was going to go on break, so he was on his back, and we said we were okay, when you get back on your break, maybe if you don't mind putting him prone. He was still intubated. She's like, no problem, but he would not have it. he was fussy with her. She was really sweet. She's like, you know what, I'll do it now. And then she stayed, she bundled him. He was being too fussy. He's like, no, I want prone, give me prone. And so yeah, you're right. You're right. They had character from the beginning. You're right. That was really nice of her. Yeah.
It was very nice of her to actually, I mean, you tell me to delay my lunch and you're going to be on my bed end for a very long time, right?
Yeah.
But she was such a sweetheart. She's like, all right. She's like, I guess I'll be eating half an hour later. And she was so at ease with it.
Yeah.
And she did it. And then it reverts back to the whole family environment, right? So it's not just a family. We're not the only family that Massimo has. He had a slew of aunts and uncles. Like we still kept in touch with a few of them, and it's always auntie this or uncle that, just because it's a bond that you will never forget. You may not see each other on a regular basis, but you don't forget that moment. You know, like these little memories.
But you're right about the piece of the guilt, especially. I know I guess more for women, like my wife at the beginning. She kind of had that sense of like, oh, well, this is my fault. He's going through this, especially when, you know, maybe not during the good times, maybe not when there's a day where he has no events, but, you know, when there's the bad times, kind of goes through your mind. And I definitely try and tell her, you know, put that out of her head, and we were also fortunate. He's our only child, so we were able to devote 100% of our time there, and we were able to be off work and everything. So we kind of looked at it as like, well, we're able to help them, we're able to be there. Maybe other parents have 2 or 3 kids at home and they can't be there all the time, or the father can't take off work. So we try to look at it always on the positive side, because you're right. If you look at it on the negative side, you're just going to go down this rabbit hole, and it's just not going to be healthy for the baby, for you, for nothing.
And it's a feeling that is universal, even if we try to, you know, explain and be logical and then say, you know, it happens, no matter what you try to do to prevent it, it happens. And it's going to continue to happen until science gets us to find new solutions to prevent, you know, preterm labor and things like that. But we're in a place where 10% of the babies are born preterm, you know, so that's 1 in 10 that are born preterm. And that's just the reality we have to do and to help. And that's why we're here. And that's why, you know, we're here to support families that are going through that. I want to go maybe a bit further in the admission of Massimo. So tell us how, you know, because Massimo stayed for a good 18, 20 weeks in the NICU, I think.
6 months. 6 months.
6 months.
Yeah.
So 24 weeks. 24,
yeah.
yes, exactly.
That's correct.
Yeah.
And, you know, went through a lot. I think there were some airway concerns, you know, the feedings, and then, you know, had to get back on the ventilation because of the airway issue. And then eventually we're able to wean all of this. And then he was able to go home, breathing room air and doing quite well, but still required a bit of feeds at home with gavage, I think, while he's learning to get back on track with his own feedings. So maybe throughout these 24 weeks and 6 months, tell us, where was your mind? How did it go? How did you feel involved in the care of Massimo? What did you find was your place as parents when you were at the bedside in the NICU with the nurses, with the doctors, with Massimo himself? Your perspective on that.
Well, we try to be as involved as possible. So like you said, he was actually feeding through the G tube, right? So which is, I think that's the gavage.
Yeah.
Is that it? Yeah. Okay. So he was feeding through the G tube. Long story short, like you said, he had airway issue, and his ENT doctor said in order to resolve this, you know, he can't be taking anything by mouth. He has to be through G tube, and that's how we're going to feed him. So that's fast forward. That's where we're at. But we did everything at the hospital. Like our to me, this is my son. Like, yes, he is at the hospital. He's a nurse, but we have the time on our hands, and we wanted to be as involved as possible. First, I wanted to learn things as soon as possible, so that when you give us the okay, we don't need any training, we can go home right away. But also we wanted to be involved so that there's some sort of normalcy of things, right? Like, this is our kid, fine, we're not home, but we're in a little 4x4, but this is our family. So we took care, like when we were there, we took care of the feeding. We cleaned, we gave him a bath we took very seriously at the Lucifero room. So like I think the nurses kind of recognized as the parents that we were involved. So when we were there, we just needed a few things here and there, but other than that, day-to-day activities, we were there. At nighttime, that was when we'd go home to sleep so that we can come back the next day and be involved again in the activities. I don't know if you have any.
Yeah, no, and to kind of continue on your point, where can we saw ourselves is kind of the consistency. So obviously nurses rotate and they stay 2-3 days with the baby and then off, and then maybe go to another baby later on. So we want to be as involved as possible to learn his habits.
Mhm.
So we make sure that sticks. Learn what he likes, learn what he doesn't like. Try and keep kind of the familiar, like you said, the voice, the touch. So we do as much as possible. Like really early on, nurses were very nice teaching us feed. I remember feeding him for the first time 2 ml on the syringe.
Yeah.
It took she was really sweet, the nurse. It took me 8 minutes to feed him 2 ml. I was going very slow, and then I said, "Did I do well?" She said, "You did great." And then I asked her, "No, but really, did I do well?" And she's like, "Well, you were really slow, but that's probably good for his digestion."
He took it very seriously.
So yeah, that's what we saw ourselves, is that consistent individual to really, the next nurse that came in, maybe we weren't there for whatever reason, or at night, hey, he likes this, he likes prone, he likes to hold something when he's on the side. So that's what we saw ourselves in his care, to be that one individual, those 2 individuals that are always there. And
but by doing that, I also find that the nurses kind of learn to trust us as well, right?
Okay.
So there's that bond. They're like, well, okay, we're there for 12 hours, 15 hours a day. So when we're saying something, the nurse is kind of like really trusted our opinion, or and the doctors trusted our opinion too. Like, this is what I think. I don't think he needs to be fed 5. I don't, like, at a point I think we were trying to condense his feedings to go 6 times a day to 5 times a day. Well, I don't think my son can handle it, like so, and it's not because I'm being a pessimist. It's just because you get to learn what he's capable of. He does not have a big appetite. He has a small appetite, and that's okay. Everybody is completely different. Like, I can eat 10 times in a day. Maybe I won't be able to eat as much at one meal, but if 10 times a day it is for me. So and I think because we were there, and because we spoke up, and like, people took our opinion very seriously, and they were like, all right, okay, we see your concern. What do you think? I think we can do this. All right, let's try it out, or let's tweak it. So it was more of a team effort. So it wasn't just the medical staff and they're telling us what to do and we're like little puppets following. It was more of an interaction, as like, everybody, let's make a decision that's right for Massimo. So
That's amazing.
Yeah.
So we saw each other recently and we're going to talk about it. But before that, I just want to say, the way I see Massimo now he's like 10 months, 11?
11 months, that's right.
11 months. Yeah. I see him as a very curious boy. Yes. Very, very, he has like this spark in the eyes. He looks at you. He's super interactive. He's smiling. He's very, discovering the world like a sponge. Like, you can see that he's like extremely, extremely curious and happy and joyful. And, I think he gets that from somewhere. I want to hear what you've perceive Massimo, like your views on his personality and his, because often one of the questions we get as neonatologists is like, wow, he's born young, she's born young, what to expect later? Are they going to have their personality? Are they going to be able to interact? Are going to be able to learn and be curious about the world? And for sure, when you see Massimo, there's no doubt that they are, like, so I want to hear, a bit of your perspective.
That's a good question, and actually, it's funny you mentioned that, because during we had you're going to get to probably a recent admission, but during that stay, one of the physicians made a funny, interesting comment, saying, Massimo was a pandemic baby, so if he was born maybe term, it may have been still during lockdown. It may have just you been at home with your wife and Massimo at home, and that would have been his world. But he was born very premature, and all of a sudden his world became a lot more people.
Mm-hmm.
And he's very, like you said, he's very curious, and he likes people, and he always likes to look at the door, to a point where I recall one week the nurse practitioner that had him that week asked the nurse, can you turn the door, the bed this way for the head of the bed, because he wanted his head to turn that way, because he was always looking at the door. So he's very curious, like you say, he's a very friendly baby, likes people. So it's curious that even, maybe not born term, how maybe he would have not been as interactive with individuals, but born very premature and in an environment where there's a lot of people there, dealing with him, speaking with him, playing with him, not just the parents. We're curious if that impacted his development in a positive way. So I don't, like, maybe I'm getting a little off on your question, but I don't see him personality wise much different than if he was maybe born term. But you asked me this question day one of life, I would have maybe had those concerns. Was definitely valid concerns, but like looking at him today, I guess personality is very, very, like you said, very curious, very interesting. Oh yeah, sometimes.
We were there all the time, like Anthony mentioned, right? So, and we're very, very, very talkative people. We are social butterflies. The pandemic is kind of tampering with all of this, but so we always had conversations, and we always made a point to stand around Massimo to have a conversation. So it wasn't just, it's either him and myself, it's either reading him a book, it's either singing to him, or it's either just having random conversations with Massimo, or sometimes it will be a nurse walking in, and a nurse practitioner, whoever walked in. We always had conversations around his bed. So he's very used to that. So I find that played a very big role in his development. He loves the attention, and then there was a time when we were not there, because we had to kind of like make sure that his room is ready, since we were getting discharged. It was closer to discharge day, and we were not there. And I think that was the first morning where neither of his parents were there. So exactly, you know how like when the rounds happen, where the doctors and the nurses and everybody, the whole medical staff are talking about Massimo's situation, what to do next. And he caused a fit. He wanted to be part of the conversation, because that's what he's used to, right? Like he's like, well, how dare you not involve me? So the doctor had to come into his room and then do the whole presentation with Massimo, because that's what he wants. His sleeping patterns, like from day one, we have pictures of him flinging his arm all over the place. Like he hated being bundled. You know how like they always kept on saying he's an extreme premature baby, you have to bundle him, they love it. I'm like, my son is the complete opposite. You have to unbundle. And he still sleeps like that. Like he still flings, like sometimes we wake up and his legs are up in the crib and he's just lounging. So I find that from day one to now, he's held on to his personality, but obviously he's gotten more curious, he's gotten more expressive. But it's again
more problem solving. Like just the other day, the toy was at his feet, and I guess he's not able to sit up. So with his legs, he lifted the toy up to get it. So
instead of trying to reach for the toy with his hands, he's like, "What's the laziest way I can get it?" And that's by taking it within his legs.
So to answer your question, I'm having trouble seeing how, if he would have been born term, he wouldn't have had this character and this way of looking things. He probably would have been the same.
But we also acknowledge that even though Massimo's birthday is this month, he's not a 1-year-old. We get that, right? So we're really used to using the term corrected age. It's instilled in us, and we're also very okay with his corrected age is 8 months. He's not acting like an 8 months. He's acting more like a 6 months. And to us, we're okay with that. And I think that's very important, because if you start putting stress on you, the baby senses it, and then he or she may not react the way you want. But when you just let it be and you're like, I'm going to try to help you as much as I can, I'm going to be involved. And, for the longest time, he was so close to turning, but it took him 3 months to turn. I'm like, how hard is it to turn to flip, right? But once he got it, like he just goes ahead and does it. So like I stopped asking friends what their kids are doing. I'm like, I don't care. I'm like, this is Massimo. Eventually he's going to catch up to everyone. No one's going to know. So I think we just have to go into it with the mindset that yours is not a really true 1-year-old. He may be a few months behind. that's okay. It's not the end of the world. Your job is just to be there and to take it day by day. And I think taking away that stress, it makes parenthood funner too. Otherwise, you're just stressed all the time.
Yeah, because like you said, he absorbs everything.
Yeah.
So like we follow daily the exercises the physio gives us. But if we stress that he's not doing it, he's in a sensei. But if we try, okay, doesn't do it. The next day we try again, and day 3 he'll catch it. So that's been our approach. And so far, actually, we had our physio today. She was very happy. So,
and it's so, I mean, it's so important you share that, you know, first of all, as parents, you're so involved in providing like a lot of, you know, stimulation to Massimo and love and care, and also normalize the fact that you guys are young, you know, you're a family and there's joys and, you know, all this family structure and his first few things that are, you know, first time he turns, even if it takes 3 months, it's still a big joy. It's like, yay, and you cannot, you know, impose an agenda. And I think it's the same thing of the reality in the NICU. And sometimes we get questions like, when are we going to start this? And when we're going to, like, it depends, right? It depends. Like, we cannot impose an agenda on the baby. It's like, as a family, we go along and we respond to what baby is doing and what, you know, how baby is ready for certain things. So although we want to have like a, you know, this will start and then we'll stop and then we'll start and, you know, have a sequence, it's often more, we have to listen to what baby is telling us, right? And I think you as parents, this is what you're doing. You're listening to the needs of Massimo and you're addressing them and celebrating each victories, right? And that's what is super important. Creating these memories, celebrating all these victories, and, you know, giving so much love and such a amazing family structure.
Oh, thank you.
So, yeah, definitely, it's obvious. And I know time is running, so I really want to address the recent occurrences, because I think that's very important for some of our population of babies. So Massimo was found to have, after discharge, at around 9 months of age, if I remember well, significant pulmonary hypertension. And the initial diagnosis, or at least concern, was found on echocardiography. And then after that, it got confirmed by more advanced techniques where they went and they measured the pressure in the lungs. And at the time, there was quite a lot of concern for the heart function. So that's why we needed to intervene and start some treatments for preventing this from deteriorating. And thankfully, he has beautifully responded to the treatment. And now his heart is like perfect. So I want to get back a bit to the aspect of pulmonary hypertension, because I think right from the get-go, you were aware of this possibility in the NICU. We had mentioned it. And one of the reasons we had mentioned it, I think it's because you accepted generously to be part of a research project that we're running in the NICU on pulmonary hypertension. So first of all, I want to hear a bit more about what you lived in the past few weeks regarding that. And then maybe to stem and then say for you what research means and why did you decide to participate in the research project?
We'll start addressing that question first, actually. So when we were first admitted, you don't think about all the bad things that can possibly happen. You're like, okay, he's born, so I guess we just wait it out here, and then he's gonna grow up, and then we're gonna get to bring him home, right? So when he came, you're like, okay, so it's a research program. It can help babies, you know, like we need to understand why it happens, how it happens, like, you know, more data is needed. And Anthony and I looked at each other, we're like, well, if Massimo can help someone else, like if he can help another baby, why not? Like, we want to be part of this. Mm-hmm. So that was why we did it, right? Because it's important to have all the data available so you can make the right decisions, you can diagnose it, right? So if you don't, and it was not harmful, it's just a heart echo. And if it's 1 day out of 6 months that takes an hour out of my day, well, I'm more than willing to do that, because if it's going to help someone else out, like someone's willingness to participate in studies helped Massimo out, so why not pay it forward and help in whatever way we can? So that was our logic. So that was our good deed of the year, right? We're like, okay, we're going to participate. It's going to help a baby. We did not know it was going to end up helping our own baby. So karma, it works in mysterious ways. So like you're right, it was mentioned, it just never really was mentioned as a concern for Massimo, because he did go home with no oxygen. Everything looked fine. He had mild, but I guess it was more common than not having mild, and that it was gonna just be okay as he grows, as his lungs grow, he's gonna get stronger. But they still wanted to follow up because research echo showed that he had mild hypertension, a pulmonary hypertension, and then the cardiology team got involved, and they're like, oh, it looks okay, but you know what, just to follow up, September appointment, we'll see you then. Fantastic. I think that was the first time going to the hospital. I was not concerned. I was like, well, everything's gonna be okay. And this is where we ended up getting the news that it went from mild to severe. And I think we just did not grasp it. We didn't understand it. We're like, well, no, I thought we were done. Like we spent 6 months in the hospital. We're not coming back here. So okay, well, maybe it's airways related, maybe it's oxygen, maybe it's this. So like they kind of had to go through the whole elimination process. And so like he mentioned, it was one of those things where it is what it is, and hopefully it's related to prematurity, and he responded really well to the medicine. So it took 6 weeks. I understand that it could have taken longer, it could have been shorter, it depends on every baby, it depends, right? So every baby responds to things differently. And then we were at the PICU, ACU for about 6 weeks, where they were trying a little different things, introducing him to a new med and off, and finally they came to a good balance of what he needs, and then we were sent home. Obviously now we're going to be followed very closely by the cardiology team, but that's where we're at for the moment.
Yeah, and just to get to your question, like it's a nice, like my wife said, it's funny how karma works. Like the research study initially meant to us, like, oh, you know, Massimo's in a population that's ideal for the study, and maybe it'll help other babies, and it kind of came back to help us, and in a really probably a perfect timing, because like even as you saw him the day of, he showed no signs. Like we were having, he was himself, he was playful, he was rosy, and when the cardiologist was explaining to us, like, you know, this is serious, this is severe, it took me a while to kind of
like, are you sure?
wrap my mind around it, you know. So
I remember. Yeah. I remember actually, because I was asked to go and repeat the echo the next day, because anyways he was going to have his research echo, and they kind of wanted to, because there was a few elements that was not addressed on the clinical. Well, you know, most was seen, but you know, when discussing with the cardiology team, they said, well, if you're going to do an echo, let's repeat, you know, some of these views and then try. And I remember trying to do the echo with you guys, and I'm the one scanning, and you're holding, and he's kicking, and he's forgetting. And I'm like, still 1 second, please, Massimo. You know, like, and I remember, and then we had the discussion saying, like, you know, it's true, it's quite concerning, to the point that we actually admitted you right away from home to the ICU so that they could right away start some kind of treatments, because the heart was the concern. And now we're very happy to see that the response was actually extremely good. He has completely recovered, and you know, he needs treatments for that, and he might need treatment for a bit of time, but the hope is that he's going to get rid of this treatment eventually, when he's going to be growing and becoming a big boy, and eventually, you know, an adult, and who knows what he wants to do of his life eventually. But you know, I think this example outlines also how we still need to understand better some of the things we do in medicine to really continuously get better, and not just say like, oh, we know what to do and this is what we're going to do, and then not evolve, right? Because it's so important that we want to maximize and promote and really help all the babies out there, and just get better and better and better at these things. So I really want to thank you, because it's already been 45 minutes that you've been sharing your story with us. And I think, you know, you're really a perfect example of a wonderful family that went through, you know, we've seen it as an outsider. I think I was, you know, I've seen Massimo throughout his hospital stay, and it was so clear that you were so dedicated, so involved. And yes, it was a roller coaster. There were challenges. And for family that are maybe just starting in the NICU, it can be so overwhelming. And as a physician, sometimes that's the part that I feel the most powerless. Powerless, yes, because it's like, how do I translate what it is the day you're going to be discharged, right? Because sometimes some parents don't even want to think about that. Sometimes they're such in the acute setting that you don't know what's going to happen. You don't know how your baby's going to go. And to try to bring a family perspective, even if it comes with challenges or, you know, joyful moments or just joyful moments or just challenge, it just maybe gives some perspective, some hope that me as a doctor, I cannot translate to families, right? I can talk about the medical things. I can talk about what oxygen does or what the, you know, machine does, but at the end of the day, parents want to hear parents. And I do think with the pandemic, sometimes it's harder, right? Yes, you're in the same environment of the NICU, but now we're a single room NICU. So our rooms, you know, it's great for confidentiality, for kangaroo, for some quietness, but at the same time, when you want to bond with other families and then see their perspective and see where their baby is going, it's hard to get that with the pandemic, with the single rooms and all these things. So maybe this will help some families get some perspective.
Well,
I
really hope so too. And just to go back, as you know, Massimo came with a lot of challenges, right? He's still going through challenges, but we're really proud to say that he no longer needs to use his G-tube. We've been able to bottle feed him.
No feeding the G-tube.
And we're actually we actually know a family whose term, unfortunately, due to some complications, had a G-tube put in. And I was like, listen, if my baby can go through this, who had major airway issues, and we only started bottling him later, like it is something that you can overcome, right? So yeah, life throws a lot of complications, but that doesn't mean that we can't get through them. Sometimes it just takes a little bit longer. So
yeah. Thank you so much. Thank you for your time and for sharing that. And really, I'm already, you know, excited to see you again in Massimo, and I'm sure you'll come for appointments, and we're just gonna hear good news. That's what's gonna happen.
Thank you so much.
Thank you.
Thank you. I'm gonna close the recording now. Thank you.